Thank you. Be a trick to manage three things with two hands. Anyway, thank you to TEDxBuffalo team for the opportunity to come and talk about how healthcare, or more specifically health, relates to a community in motion. Now, all of us have had experience in one way or another with healthcare and the healthcare system, whether it's the challenge of finding a primary care physician or dealing with a sick parent. The challenge of managing the system is something that we've all experienced one way or another. But today, I really want to talk about the elephant in the room as it relates to healthcare, because we all understand that healthcare is expensive, but I think it's important to understand how expensive it is, what the opportunity costs are, and what we can do about this. So to put a little context around this, this is a chart that reflects data collected by a company called Milliman. They're a healthcare consulting firm, and they track healthcare costs around the country. This chart reflects the costs of healthcare for an average American family of four with historical data from 2004 to 2013. And when I say the total cost of healthcare, what they're calculating is the amount that an employer contributes to a premium for an employee, the amount that the employee contributes to the premium, and then whatever might be incurred as a cost at the point of service by any one of those family members. So it's the total cost out of pocket for healthcare for this average American family. You can see that the growth rate from 2004 to 2013 exceeds 7%. And if you extrapolate that forward at even lower growth rates than that 7%, when you get out to 2023, it comes to either $30,000 or $40,000. Now, you need to look at the red line across the top, and the red line across the top of this chart is the median household income for an average American family of four. Again, historical from 2004 to 2013, but extrapolated forward at the growth rate into 2023, what you can see is that healthcare could consume between a half and 2/3 of the average American family's income by 2023. So that elephant just got bigger. And it's a symbolic because the costs of healthcare are beginning to take on a significant impact in terms of the cost of doing business. Healthcare is a cost of doing business, and now it's getting to the point where healthcare is, after labor, the second largest cost of doing business. So the communities that get healthcare right are going to be the economic winners going forward. Corporations are beginning to notice this, and they're starting to take a look at where they want to site their next business, and it has to do with communities that get healthcare right. Because the costs of healthcare are beginning to crowd out not just individual families' choice of where they want to spend their money, but they're beginning to crowd out investments in social good that communities can make, in education, infrastructure, and other entities that could be invested in. So, you wonder, you've heard the expression, how do you eat an elephant? One bite at a time. If we're going to begin to address this issue successfully, we need to understand a few facts about what's going on in healthcare. And the first fact I want you to understand is that about 30% of the $2.7 trillion that the U.S. spends on healthcare today is dedicated to services that don't add value for the individual receiving those services. Now, it could be something as simple as a repeat test because the doctor seeing the patient didn't have the results of the test that was done by another doctor, or it could be something that's actually been proven in the scientific literature to be harmful, that the patient is worse off after the intervention than they were before. Another fact, when something's been proven in the medical literature to be effective, it's only provided to the patient who needs it 50% of the time. Half the time, missed opportunities to make a difference in preventing a disease, screening for a cancer, or managing a condition more effectively. Third fact, the amount of money that is spent in Medicare at the end of life, taking care of people in critical care or other situations who, if they had the opportunity to act out their own wishes, wouldn't be being treated in that way is astronomical. But the most important fact that we need to talk about today is that of the $2.7 trillion we spend on healthcare today, about 70% of those dollars go to treating chronic diseases such as heart disease, diabetes, hypertension, certain cancers. These chronic diseases that relate back to personal choices about behaviors that we make, behaviors that we exhibit. Behaviors such as whether or not we exercise, what we eat, whether or not we smoke, how much and if we drink, how we handle stress. These personal decisions and these behaviors are the single biggest determinant of the costs of healthcare in this country today. So, knowing those facts and knowing that the federal healthcare reform bill sets the table for beginning to manage healthcare differently, recognizing that there are healthcare system investments being made in paying physicians and other providers differently and creating more integrated and aligned care to help the systems become more efficient. The 70% issue is the biggest issue that we have to confront as a society. And the communities that get that 70% issue right are going to be not only the healthcare winners, but the economic winners going forward. So, how do you begin to take that first bite out of the elephant and begin to address this issue? Well, there's a great book out there that was written by Carrie Patterson and some colleagues called Influencer. And Influencer looks at decades of social science research around creating broad, sustainable social change, whether it's change related to the eradication of guinea worms in Africa or change that's related to reducing the recidivism rate for criminals in the San Francisco area. Change that is substantial and sustainable can all be addressed through a very interesting model that understands that there are 6 major influences of behaviors. And by going through this model and this framework, you can identify certain vital behaviors which then can be addressed, which can lead to significant sustainable results. So as a community, if we want to address that 70% issue, this is a wonderful framework to begin to look at. And in fact, in Buffalo, we've already begun to act out this framework with some significant results already to show. The framework, relatively straightforward, relatively simple. The 6 influences relate to motivation and ability. And if you think about impacting motivation and ability on a personal level, a social level, and a structural level, the ability to reach a significant portion of the population and create that sustainable change is greatly enhanced by addressing 4 out of these 6 sources of influence. The social science research shows if you can address 4 of these, the likelihood that you're going to have a sustainable change is greatly increased. So, let's talk about what's going on here in Buffalo. On the personal motivation side, at Independent Health, we've had the interesting opportunity to introduce a new benefit that actually rewards people for making better choices about what they eat. Working with TOPS, we have a nutrition benefit that gives people $1 credit for every $2 that they spend on fresh fruits and vegetables. And the uptake of that has been really incredible and exciting. On the personal ability side, we heard earlier about a soccer coach. We have been involved in this program, the Soccer for Success program, with a grant from the USA Soccer Foundation, where up to 20 schools in the city of Buffalo have programs after school where these kids are being taught not just the skills of playing soccer, which they can sustain over a lifetime because it just takes a ball on the field to be able to play soccer, not a hockey rink and a $200 stick. but they're also being taught about nutrition and the importance of fitness and how to work together to change their behaviors. On the social level for motivation, we just started a program recently with the Buffalo Bills. The Bills have, through the NFL, been working with their NFL Play 60 to reach a significant number of kids in the community. We at the Independent Health Foundation have similarly been working on a Fit Kids program, and together we're going to be reaching nearly 80,000 kids in Western New York to engage them in more consistent physical activity, more consistent nutritional behaviors and habits that will lead to health. And the great thing is that we've already begun to see how these kids will not only change their own behaviors, but just like happened in the 60s and 70s with smoking, they go home and they influence their parents too. So this wellness challenge that we're doing with the Bills goes beyond the kids that we're already addressing. It's taking it to a larger scale to reach adults through the kids as well. On the social ability front, there are investments that are going on across the community, not just through Independent Health and the Independent Health Branch YMCA out in Williamsville, but the YMCAs, the Boys and Girls Clubs across the community, and events like the Fitness in the Park where there's yoga. There are other individual trainers who can help people as groups learn how to do safe, simple exercises. And in this instance, we're talking about things that are easy to do, things that are all attainable for all of us. Because when we talk about the changes that need to take place, we're not talking about creating triathletes. We're not talking about creating vegans. We're talking about simple changes that can be made. In fact, there was a study done by the folks at Kaiser, a health organization that's largely in the West Coast, but they've been around for 75 plus years, and they've looked at their membership. And one of the things that they found is that just 30 minutes of exercise 5 times a week makes a huge difference in the health of the individuals. It can reduce the incidence of type 2 diabetes by over half. It can reduce the risk of stroke by 25%. And we're talking about walking 30 minutes 5 times a week. We all know the impact of nutrition in terms of weight, in terms of fitness, but our ability to be able to just eat 5 fruits or vegetables a day can also help us with our strength, our endurance, our concentration, in addition to our health. So we're not talking about huge changes here. When we move on to the structural motivation, we're talking about design of rewards and incentives. You know, I think the governor's done a really interesting job with his economic development program here, and we're seeing it work in Western New York, where there's an incentive for us to do more of the right things to build health capacity, to build infrastructure that's going to enable business going forward. And then on the last dimension, structural ability. What is it that we can do to change the environment? Well, we're seeing a lot that's going on here in Western New York. Here's some pictures of an event that Go Bike Buffalo helped to arrange with the assistance of the City of Buffalo and the New York State Transportation Department. And the second weekend in June, it was a biking event over the Skyride that in short order, with the cooperation of Go Bike Buffalo, the city, and the State Transportation Department, we got to shut down the Skyway and attract nearly 1,000 riders to come out on a beautiful Saturday, ride the Skyway, see the city, and really enjoy themselves. So the city, in terms of creating some structural changes, is enabling more bike safety streets throughout the city. They can also do things like legislation that enables community gardens like the Massachusetts Avenue Project to occur more often around the city. Employers can do things on the structural front to put walk stations into work to help people do physical activity at work while they're actually working. So these 6 levers are all there, and they're all there for the taking. Now, why is this so important? Why do I get excited about this? Why do I talk about it? Well, it's not something that is capturing the interest of just the healthcare industry now. governments, corporations, foundations are all taking an active interest in this. This map is a map that shows some results of a study done by the Commonwealth Fund a couple of years ago. The country's divided up into 306 areas for Medicare purposes, and the Commonwealth Fund went out and ranked from 1 to 306 the areas across the country in terms of the affordability and the quality of health care. And what was interesting is that there was a strong correlation between poverty and a poor score. So when Buffalo came out, number 54, in the top quintile in the country, they said, whoa, there's something interesting going on there, because we know Buffalo is a relatively poor city, but they're bucking the trend. So they actually came and they did an in-depth report. We're one of 3 communities across the country that they came to study. And what they found was absolutely fascinating in terms of the spirit of collaboration, the spirit of community, the can-do attitude that is going on in this community around health and health care going forward. So one of the things that I want people to take away from this conversation is that elephant in the room, the conversation really should not be about health care. The conversation should be about health. And when we think about the 6 areas of influence, and we think about what's attainable, what's doable, all of us can do something. And then lastly, the more that all of us do, the more we play a role, whether it's you as an individual making a commitment to exercise more, to eat better, whether it's you as a member of a church group that's going to make a commitment to your neighborhood and your church and do something, whether it's you as an employer, we can all do something. And we all need to do something, because the more of us that do something, the more likely it is that we're going to change that map. And Buffalo can go from 54 to number 1 and become an even more desirable place to live, to play, to have fun, and for corporations to want to come to, because we've got not just health care, but we've got health right. So I encourage all of you, think about what you can do, get out there and do it, and the more that we and our colleagues do it, the more likely we're going to change this map. Thank you very much.